In Laos, a beacon of hope shines for people living with HIV/AIDS. This beacon is APL Plus, a network dedicated to empowering lives and combating stigma. APL Plus emerged during a time of great need as Laos faced a growing HIV/AIDS epidemic. The organization's roots were planted in the year 2000, marking a transformative journey. From humble beginnings, APL Plus has blossomed into a powerful force for change. The organization's growth is a testament to the commitment of its staff, volunteers, and supporters. APL Plus has expanded its reach throughout Laos, establishing a presence in remote communities and urban centers alike, driven by the belief that everyone deserves access to quality healthcare. As APL Plus has grown, so too has its impact. The organization has touched countless lives, providing medical care, emotional support, and educational resources. APL Plus has also shaped public policy, advocating for the rights of people living with HIV/AIDS. Today, APL Plus stands as a testament to the power of collective action and the human spirit. The organization's journey is a source of inspiration, reminding us that hope can prevail and lives can be transformed. As APL Plus looks to the future, it remains committed to compassion, empathy, and support for those in need. At the heart of APL Plus work lies a profound and unwavering mission to empower people living with HIV/AIDS in Laos to live long, healthy, and fulfilling lives. APL Plus envisions a future where HIV/AIDS is no longer a barrier to opportunity, where people living with the virus are treated with dignity and respect, and where stigma is replaced by understanding and acceptance. APL Plus aims to make significant strides towards ending the epidemic in Laos by 2030. This requires addressing social, economic, and cultural factors. By fostering empathy, understanding, and acceptance, APL Plus creates a supportive environment for people living with HIV/AIDS. Central to APL Plus' mission is a steadfast commitment to equity and inclusion. The organization recognizes that access to healthcare, education, and economic opportunities is not evenly distributed in Laos. Certain populations, often marginalized and underserved, face disproportionate challenges when it comes to HIV/AIDS. APL Plus is dedicated to reaching these key populations and ensuring that they have an equal opportunity to live healthy and fulfilling lives. Among the key populations that APL Plus prioritizes are men who have sex with men, transgender individuals, people who inject drugs, and sex workers. These groups often face heightened stigma and discrimination, which can make it difficult for them to access the services they need. APL Plus provides tailored support to these communities, creating safe spaces where individuals feel comfortable seeking testing, treatment, and counseling. APL Plus' commitment to equity extends beyond its direct service provision. The organization also works to address systemic inequalities that perpetuate health disparities. This includes advocating for policy changes that promote equality and justice, as well as partnering with other organizations to address the root causes of poverty, discrimination, and social exclusion. By prioritizing the needs of marginalized communities, APL Plus is working to create a more just and equitable society for all Laotians. The organization's unwavering commitment to inclusion serves as a model for others, demonstrating that true progress can only be achieved when everyone has the opportunity to thrive. To guide its work over the next decade, APL Plus has developed a comprehensive strategic plan for the years 2022 to 2030. This plan outlines the organization's key priorities and provides a roadmap for achieving its ambitious goals. The strategic plan is built around 4 interconnected pillars: healthcare access, economic and educational opportunities, stigma reduction, and capacity building. Under the healthcare access pillar, APL Plus aims to increase the availability of HIV testing, treatment, and care services throughout Laos. This includes expanding its network of clinics and outreach programs, as well as strengthening the capacity of healthcare providers to effectively diagnose and manage HIV/AIDS. Recognizing that economic empowerment is essential for well-being, APL Plus is committed to improving economic and educational opportunities for people living with HIV/AIDS. This includes providing vocational training, microfinance initiatives, and educational scholarships to help individuals achieve financial stability and self-sufficiency. APL Plus understands that stigma is a major barrier to accessing healthcare and living a full life. The organization's strategic plan includes comprehensive initiatives to reduce stigma and discrimination through public awareness campaigns, community dialogues, and educational programs. These efforts aim to foster greater understanding, empathy, and acceptance of people living with HIV/AIDS. Finally, APL Plus recognizes that its long-term success depends on building the capacity of local organizations and communities to respond to HIV/AIDS. The strategic plan prioritizes capacity building through training, mentorship, and technical assistance programs. By empowering local stakeholders, APL Plus aims to create a sustainable response to HIV.
We all need someone to hold, a friend to light the way when the world starts to unfold.